Folate, folic acid, methylfolate. If you have been trying to work out the difference, you are not alone. Here is what the research actually says. Folate is one of the most critical nutrients in preconception and early pregnancy. It supports the formation of the neural tube, which becomes the brain and spinal cord, and that structure closes around 28 days after conception, often before a positive pregnancy test, which is why folate status matters before you are pregnant, not just after. You get folate from food, leafy greens, legumes, citrus, but it is difficult to reach pregnancy requirements through food alone, which is why supplementation is recommended. There are two forms in most supplements: folic acid, which has decades of clinical trial evidence showing it reduces neural tube defect risk when taken at recommended doses, and methylfolate, which is the bioactive form your cells actually use directly. It bypasses the conversion steps folic acid requires. Both raise active folate levels. Both support the same biological work. The strongest population level evidence for preventing neural tube defects is tied to folic acid specifically. Methylfolate has not been studied at the same scale, not because it doesn't work, but because those trials have not been done yet. Becoming a bit more technical here, some women have a genetic variation called MTHFR that reduces their ability to convert folic acid to the active form. If you have that variant, methylfolate may be the better fit, but, and this is important, most people with MTHFR variants still maintain adequate folate levels on folic acid at recommended doses. This has been proven. So it is not automatic. It is a conversation to have with your practitioner. Complete Support contains both 400 micrograms of folic acid and 100 of methylfolate to cover both pathways. Complete Support Sensitive uses 500 micrograms of methylfolate only, without folic acid. Same total folate dose, just different forms. So you can choose based on your context, not online ideology.